Good evening, ladies and gentlemen, and welcome back to SF Commons. We have a special show tonight. The next topic of our conversation is Medicare. In this economy, with all the discussions, the debates, in Washington, D.C., trying to balance the budget, trying to make ends meet, the fact that people are struggling daily, we have a lot of problems. So one of the issues we have to talk about is healthcare, and healthcare has a lot of components. As you very well know, people have been talking about the Affordable Health Care Act, Medicaid. Now we will talk about Medicare. We're very fortunate to have a very distinguished guest, Mr. Max Richmond. And let me just tell you a little bit about how fortunate we are to have Max Richmond in the show. Max Richmond is a former staff director of the Senate's Special Committee on Aging and a 16-year veteran of Capitol Hill. He is the president and chief executive officer of the National Committee to Preserve Social Security and Medicare. Max Richmond had directed a lengthy investigation of the Equal Employment Opportunity Commission's enforcement of age discrimination statutes and developed legislation to establish a consumer price index for the elderly, which if adopted, would lead to a more accurate cost of living adjustment for Social Security beneficiaries. And well, he's very smart. He was born in Munich, Germany, and grew up in Omaha, Nebraska. He graduated cum laude from Harvard College and received his law degree from Georgetown University Law School. He is the vice chair of the Seniors Coordinating Council of the Democratic National Committee and a member of the District of Columbia Bar. Smart guy. And we just had him on Social Security, and very fascinating gentleman. Well, Max, welcome. Nice
Thank
to see
you.
you again.
Thank you for inviting me.
Thank you so much. So, Max, let's talk about Medicare. What's going on in Medicare? A lot of people are not aware of Medicare. Really, it's just like when people talk about Social Security, people start thinking about Medicare when they hit like the 60s, but then you have this entire generation of people who should really be concerned about Medicare because it's healthcare. So could you please just go to kind of explain sort of like the background of Medicare and what it covers, and there's been a lot of changes on Medicare and
Well,
so forth.
sure. Well, Medicare has a couple of different components. Part A is the hospital part, and that is provides beneficiaries who are 65 or older with care in a hospital. That is paid for by a payroll tax, just as Social Security. It's a smaller amount that's attached to every paycheck, and it provides funding for the Part A hospital trust fund, and that pays for hospital care.
Right.
Then there's the Part B component of Medicare, and that is for other providers, doctors and other providers. Now, that is not paid for by a trust fund. That is paid for by a formula that is three quarters federal money and one
Right.
quarter premiums. So the amount varies year to year depending on how many people are participating, but it's always divided up one quarter out of premiums and three quarters out of federal
Right.
dollars, direct federal dollars. An additional component was added to Medicare, and I'm sure some of the folks listening are aware of this because it was a big deal. And that was in 2003, a prescription drug benefit was added to the Medicare program. That is also paid for out of premiums that individuals who choose to sign up. It's not mandatory. They pay a premium and they get a better price, not as good, we think, on prescription drugs, but they get some help with their prescription drugs. A lot of folks think Medicare covers other things as well, and it does not. And I have found many seniors surprised when they turn 65
So,
and
Max,
some
this is exclusively for seniors. Medicare is, right?
exclusively for
Right,
seniors. There's no, it's not a means tested program. It's
right,
not based on your assets or your savings. If
right.
you turn 65, you qualify, regardless of what your financial situation is.
I see.
But a lot of seniors turn 65 and they think Medicare covers vision care, which
Right.
it doesn't. It does not cover glasses, eye care, vision tests. They think it covers dental care. It doesn't. Does not cover
Oh,
that.
okay. All
Does
right.
not cover hearing. So these are as good a program as Medicare is, and it's a great program. I don't think you find anybody who's getting Medicare who is sorry that Medicare exists because they really count on it. But it's not perfect. It needs to be improved, and some of these improvements are the ones I just mentioned:
Right,
hearing,
right.
vision, and dental.
So, Max, when people, just kind of adding to the confusion on this whole healthcare thing, when some people say, we should have a Medicare for all, right? I mean, when people talk about, with the Affordable Health Care Act, being dismantled, reformed, whatever the end result will be, and then the alternative would be, well, we should have single payer health care or we should have Medicare for all. What does that mean with all this terminologies being thrown around? What do you think?
Well, I agree with that. And in fact, we supported our organization, the Committee to Preserve Social Security and Medicare, supported the Affordable Care Act or
Right,
Obamacare. But we preferred a proposal, and Bernie Sanders was leading the fight on that. That was basically what you're talking about. It
right,
was
right,
Medicare for all. And what that plan would have done is instead of starting from scratch with the Affordable Care Act
right,
and
right,
all the complications, it would have taken a program that has been around since 1965, Medicare, as works pretty well,
right.
and would have allowed people under 65 to participate in the program, but they would have to pay the premium,
Right, right, right.
right? They would have to pay all of the premium. Now, as I mentioned, the premium for doctors and other providers is three-quarters out of the federal government and one quarter out of the pockets of those people who decide to sign up.
Right.
Under the plan that was considered by and proposed by Senator Sanders and others, you would take that framework, the Medicare program,
Right.
and you would allow younger people, younger than 65, to
Right.
buy into it, and they would pay for it, but you'd have a system that was already set up. So
And this
many
is
of the
and this is and
problems
this is
that
and
we
this is just
that we
public, right?
experienced with the Affordable Care Act, I
Right.
think, could have been avoided.
Max, this is completely public, right? I mean, we won't have the insurance companies involved in this. This is the working person, right?
Right,
Paying into out of their paycheck,
right.
right? A Medicare insurance that the government then will hold, just like the government holding Social Security funds. And then
Exactly.
when needed, then it's a brilliant idea.
Well, so much of the cost of insurance is because insurance companies are in the business of making money.
Exactly.
They're making a profit, and a
Yeah.
large profit. I talked to an insurance lobbyist a couple years ago, and he was mad because he had heard me say somewhere that the insurance industry was making these enormous profits, and he started explaining how much the profit margin was, and it was
We're not here. We're not
three or
here to
four
help you.
percent. And I said, does that take into account the millions of dollars in salaries that your executives
Exactly.
receive? And he said, well, no. And I said, that's where the money is. And that's why having a Medicare for all
Right.
that uh, puts the insurance industry out of business, basically, in terms of
Exactly.
health care. There's
What will
still
it take?
plenty of other opportunities for insurance.
What will it take
You
to
can
make
be
this
you
happen,
can
though,
be sure they
Max?
don't want to give up
Yeah.
that profit.
Sure. But what will it take? I mean, with your organization, right? I mean, you were talking about this. What will it take to get the American people to say, "Hey, this is great. This is what we want." Get rid of the
Well,
insurance companies. Get rid of the, pharmaceutical companies' price gouging mechanism. Let's do it. What will it take, Max?
I think it'll take enough of a realization that uh, ordinary people, can't afford to spend 8, 9, 10, 14, $16,000 a year on insurance,
Right.
because especially if they're making 30,000. It's just not realistic. So, we are a powerful senior group. We have 6 registered lobbyists.
Right.
The insurance industry has hundreds, maybe thousands of lobbyists. There are 40,000 lobbyists in Washington registered.
Wow, that's a big business, huh?
That's a huge business. And the powerful
Jesus.
ones who are able to make sure their interests are well represented in legislation,
Right.
insurance industry, pharmaceutical industry. I'm talking about the ones that have a significant impact on healthcare. So,
Yeah.
it's an ongoing battle, uh, but I think we're making some progress because
Yeah.
most people realize that there's a point at which it's no longer realistic
Right.
to be
Right.
able to be expected to pay this much money for insurance, or else to just end up going to emergency rooms, which costs
Exactly.
everybody even more.
Yeah, actually, we just did a show on healthcare in general, and then we'll be doing another one on California because the state legislature of California has come up with a proposal to do universal healthcare, but the thing about pharmaceuticals, Bernie Sanders had made a proposal to make pharmaceutical products more affordable to the average person, but that seems to have been rejected in Congress.
Well,
You
so
want to talk
far.
about?
Now, there are 2 proposals that I've worked on with Senator Sanders, and I've known him for a very long time.
You look like him.
And he actually,
Just joking.
he is exactly what he appears to be.
Yeah,
The
yeah.
man has no pretenses.
Right, right.
I did a town hall meeting with Bernie Sanders when he was still in the House, a congressman
We love Bernie here.
In Rutland, Vermont,
Yeah.
in 1994, and he was saying the same things then. I'm looking at a picture of the 2 of us from that. It's here in my office, and he was saying the
The
same
two of
things
you?
then that he said during the presidential
He would
campaign.
have been a great
Same
president.
things, only a lot
Yeah,
more people were listening.
yeah,
So
yeah.
when it comes to prescription drugs, this is a huge issue for him.
Right.
And what he thinks needs to be done is, number one, the federal government needs to be able to negotiate with the pharmaceutical companies for the best price for those Medicare beneficiaries who sign up for the prescription drug part of Medicare. Now, you remember I talked a few minutes ago about how in 2003, a prescription drug benefit was added to the Medicare program. That was
Right.
a good thing. But in that law, and it's still law, now that was 14 years ago, there is a specific prohibition that prevents the federal government from negotiating for the best price for prescription drugs. Now,
Right.
that is insane. You have an entity representing almost 40 million people, and they're prevented from negotiating. So
That's amazing.
you can imagine who was in the room when
Exactly.
that section was added to the law
Uh,
in the middle of the night. The other thing that Senator Sanders
yeah.
proposes that we have endorsed is allowing safe drugs, and he's just reintroduced a bill. I actually spoke at a press conference when he introduced it, that would, this was a few weeks ago, that would allow people in this country to re-import, to import from Canada
Right.
drugs that are safe. Canada has virtually the same rules and requirements for determining the safety of prescription drugs as the United States. And but the law right now prevents people from buying those drugs in Canada and having them sent here.
That's
So again, you know who was responsible for
exactly.
making sure that law is on the books. That would dramatically lower the price of medicine for American citizens, seniors and younger people.
Right,
So
exactly.
these are two two major initiatives that could have a huge impact. Uh, Bernie Sanders would say huge impact, right,
Yes.
on the cost of
So
medicine.
Medicare for all will be the right system. I
That's
mean, we're
right.
the only country that we're supposed to be the most advanced country, the most powerful and richest country in the world, but we're way behind. And we spend so much per capita per person on healthcare, but we're like way behind in terms of the kind of service that healthcare service is provided to people.
Yeah. These are just two examples. They're pretty egregious examples
Exactly, exactly.
of how the one of the two main reasons that prescription drugs are so expensive. There are many others. There are
Right.
proposals right now that would reduce the time that a generic drug can maintain its copyright, its patent. Its patent and allow generic drugs to be introduced. You know, there are laws now that allow a pharmaceutical company that has a patent on a prescription drug to, if a generic company that's producing a generic equivalent is ready to go onto market, there are ways that a pharmaceutical company can buy that ability and prevent the generic from going on the market for additional years. This is a very powerful industry in our country. And, you know, they've done great things. I mean, we have
Yeah.
medicine that is life-saving,
Right.
and people want to have those drugs available. But to spend this much money
That's
on
incredible.
prescription drugs is really outrageous.
Yeah, yeah. Well, Max, you guys are doing an excellent job with your
So are you.
organization. Well, we're trying. It's educating people. That's the problem. It's trying
That's
to,
right.
to get people to know what's going on in the world today, especially our world. And it's an uphill battle because a lot of the media do not cover. They do not want to talk about stuff that you are talking about, unfortunately. Well, anyway, ladies and gentlemen, we've had a fascinating discussion with Mr. Max Richmond. Thank you so much for joining us and having Max here. And again, we will see you next time. Next time, we will be talking about California healthcare. This is Myrna Lim, and good night.